All right, so this webinar where I'm going to talk about some process improvement in a walk-in clinic. This is basically an actual project which we did for a client. So this will give you an idea about how to go around, do a project, something similar to this. This can be applicable to any healthcare facility too. It might be a hospital, it might be any other clinic, something related to healthcare. So this is an actual project for which I have basically ties the customer information there. But this is kind of a methodology, what you see on the contents. We basically go through the scope of work, describe what we are going to do, how we are going to do, and what's inside our scope of the study and what's not. We talk about the methodology. We basically have the patient flow process. Once we have the data collected, then we do some analysis. It's basically a data mining kind of thing. Then once the analysis is done, we start looking the length of stay. I think for most of the healthcare facility or health industry or no healthcare facility, length of stay is a key parameter where we have some of the KPIs, right? So in the hospitals, it depends upon how long did the patient stay in an ER, or for how long did the patient stay in the hospital room. So again, similar to that, the client wanted to know how long did a patient who walked into the clinic stayed in the clinic, and so that's again what can be done to basically to reduce the overall length of stay for the patient in the clinic. Again, based on the objective of the project, based on the requirement of the project by the client, we had to, as we collected the data, they wanted to dissect the data several ways and see some of the things they like to see. So I'll basically go through some of those information, data, and also the process flow. Again, the scope of work, this project was kind of a pilot or the baseline study, which the client wanted to start before they sign us up for several other clinics they had. So basically the scope of work was to collect at least 30 patients coming into the clinic. Usually that's the average patient coming into their walk-in clinic. The format, they want to know the format of the time study, data collection, so that this can be a kind of a template for other studies to follow. All the data was collected MS Excel. I think it's a very convenient way in case we need to analyze the data to get the length of stay, calculate the length of stay, or any kind of statistics. This is a very good, as you guys know, Excel is pretty good in it. We employed one of our senior engineers to work on this project to provide, collect the data, make observation, and also make some provide some recommendation for best practices, and also kind of help them in future time study or data collection efforts. Again, methodology, brief, I won't say history, but no, we basically said which clinic we were about to study, in the general information about the clinic. The clinic had a reception area and 2 exam rooms with a common restroom. Usually the clinic had 1 clinical assistant and 1 provider. I mean, clinical assistant was kind of also helping with checking in the patient, checking their insurance, taking care of the payment in case they didn't have any insurance. And of course, they had 1 provider basically to take care of the patient. The working hours of the clinic from 8 a.m. was from 8 a.m. to 8 p.m. during the weekdays, and 8 a.m. to 5 p.m. on weekends. So basically, the time study, the way we did was, we kind of arrived at the clinic earlier than the 8 a.m. Start time because we wanted to know any other pre-start, any of the activities the CA or the provider gets into before 8 a.m. start. So we want to make note of all those in case of the staff have to clean, throw trash, and preparing the documents. So we were there a little early to take those activities into account. And also basically for such studies, we need to have a good process flow. Before we started this study, we basically asked the client to provide us the process flow of what exactly happens and when it happens. So I think the first step is basically to get the document so that you guys can be prepared to see what should be done and when things have to be done. So we had the process flow when we went to the clinic. We had the process flow in hand. We kind of understood the general process. It was not that complicated, but it's good. Sometimes there'll be some deviation in flow, and basically we need to make a note of that. Again, if you guys have the process flowing beforehand, it's something which you can plan the data collection procedure. a little ahead of time. And also a few more things about the study. We did take into account some financial work to be done by the CA by end of the shift. And as we went through the process, we basically said, no, as and when the patient, to keep track of the patient in the clinic, we kind of gave them a number, not physically to them, but in our records, so that we could track the patients through the system. And then, of course, we came up with a template to collect all the times, your start times, your end times, and basically we use a template throughout the study. So this is a high-level patient flow process. As you can see, it's not much complicated. The patient basically enters the clinic. The patient check-ins using an iPad, and they had two processes there too. One, either patient could use an iPad there, or manually sign in a sign-in sheet. Once they're done there, again, what you see, W1, W2, W3 are basically the waiting time. So a patient enters to the clinic. If the iPad and the manual check-in is busy, they will have to wait. So that's the first wait time there. So once they're checked in, then they have to wait for the CA there to call them up and go through the registration process. So once the registration process is done, they go back and take their seat and basically wait for the patient to be called into the examination room. So again, CA and the patient goes to the examination room. The CA, I think, basically we were not allowed to go into the rooms there, but only make an observation of when they went in and when they came out. So basically what we heard was basically they go through some vital statistics. They check their height, weight, your blood pressure, your temperature, or some basic vital statistics there. So once the CA takes those information, he or she comes out from the room, and then the provider enters the room, examination room. Once that's done, both the provider and the patient exits the room. Patient goes through a survey, and the patient exits the clinic. So it's a pretty simple process there, nothing complicated. But as you can see, we were there to collect all those times there, for all the E1, E2, all the way to E5, and all the waiting time there, and also, of course, the length of stay from the time they entered to the time they left. So this was the process flow. So this is basically the data. So what we did was, we collected all the information, the number of patients came. What you see on your left hand side is basically a patient arrival by the hour of the day. Usually we started from 8 a.m. all the way to 8 p.m. So you can see from there the total of 31 patients who went through the process in that clinic for the particular day. But close to, we would say, half of the patients, it was 55% of the patients arrived before lunch. Basically, the CA and the provider take the lunch between 1:30 to 2:15 p.m. As you can see, again, this data is based on only one clinic. Again, you can see number of patients arriving before the lunchtime was little erratic. It didn't have a steady flow, but you could see after the lunchtime, the patient arrival pattern was pretty steady. It was a constant 3 patients every hour. Again, we don't know why. Again, this is based on observing one clinic for one day. So we couldn't really say why it happened. Most probably, people once, especially at the start of the day, we had patients showing up at the clinic. I think they want to get it done and get going with their work. That might be one of the things. Again, there were 2 types of patients coming into the clinic: the walk-in clinic versus the appointment. Appointment means somebody had taken the appointment prior to they coming at the clinic, and walk-in is basically that they just show up. So again, a total of 38 out of 38 patients, 10 patients were people who just walked in, and 28 patients had some appointment. So that makes up to 24%. The other interesting thing is basically what percentage of patients went ahead with the process. You could see people who had appointments kind of completed their whole process through at least out of the 28 patient appointment patient, only 1 patient kind of left the system or left the clinic without going through all the process. But again, the walk-in clinic patients, you could say 50% of the people walk-in patient went through the process. The remaining 50, they just I think when they saw 3 or 4 patients ahead of them, I think they just signed in and they just left and they didn't come back. Again, this is basically the length of stay. The length of stay is basically defined as now from the time the patient enters the clinic to the time the patient leaves the clinic. The average length of stay is 46 minutes, and it ranges from 21 minutes, minimum of 21 to maximum of 110 minutes. And 84% of the patient took 60 minutes or less for length of stay. So I think the target was 60 minutes. So this clinic did well below the length of stay target the clinic had set for. Again, we're kind of dissecting the data to get some insights into. This is basically, your E1 is basically the time patient takes to check in using an iPad. As you can see, it takes an average of 4 minutes to go through the process. It is a lengthy process. If the patient is already in the system, all they have to do is now fill in the last name and first name, and it pops up the information, and they have to basically accept the health insurance has changed or not changed or anything like that. But if it's a new patient, they have to go through the whole process. Now they have to give the name, first name, last name, date of birth, health insurance, name, phone number, ID, and all that kind of information. So that's the reason it kind of varied from 1 minute all the way to 9 minutes. But more or less, most of them was done within the average of, you can say, 4 minutes. And the next process basically is now time patient spending at the front desk for registration. Once they check in using the iPad, I think for some of the patients, the CA had to physically take a copy of the registration, and she had to check with the insurance regarding the payments or the co-payment kind of information. So it took an average again 4 minutes. Again, not that much there, but again maximum was 17 minutes there. The patient time with the CA in the room, again average was 4 minutes. As I said, it doesn't take much time there. The CA, all the CA job was basically to take some vital statistics about the patient. It might be blood pressure, temperature, weight, some kind of those kind of statistics there. So, but the next was basically the time patient spends with the provider inside the examination room. So again, this varied from all the way from 6 minutes to maximum of 42 minutes, average being 16 minutes there. And you can see 90% of the time it was less than 24 minutes. So again, it all depends upon why the patient has come to the clinic, and it all depends upon the nature of the illness the patient has. Again, this is basically some statistics about the waiting time. As you can see, the first waiting time is now time patient waits to get an iPad there. Again, not much. Most of the time there was an iPad already ready there. So average was 1 minute, maximum was 7 minutes there. The second waiting time was basically once they sign in for the CA to call the patient to the front desk, further continue the registration process. Again, not much of time there, but we saw kind of some outliers there. In average, it took only 2 minutes, but there were maximum of 34 minutes. We could call that an outlier there. The next waiting time is basically patients waiting for the CA and the examination room. Sometimes you have the examination room, but the CA is busy doing something else. So it's a combination of two things there. Sometimes you have an examination room. Sometimes you don't have an examination room. You have a CA. So it's again a combination of those two things. Again, not much of wait time there. Again, the average was 5 minutes, and the maximum wait time was 40 minutes. 40 minutes there. The next wait time was patients waiting in the waiting room for the provider. As I mentioned in the process flow, both the CA and the patient goes into the examination room. CA takes some vital statistics of the patient, and she comes out from the room. And basically, the provider then will basically enter the room and talk to the patient regarding the illness. So this is basically waiting for the provider inside the examination room. Again, average being 6 minutes, maximum being 24 minutes. But now if you look at the 90% of the time, it was less than 12 minutes. Again, this is basically overall length of stay. Again, this chart basically shows all the process times, your wait times. And this is for all the patients, for the length of stay for all the patients, the walk-ins plus appointments. And one of the things which we observe is basically waiting time for the provider. That's the E2, E4, time patient and provider are in the examination room. That's the time where patient and the provider are in the examination room. Again, this is all due to the nature of illness and the nature of questions the patient has to the provider. And the other basically, I would say the I won't say constraint, but the time which consumed the high waiting time is basically wait time for the provider, W4. That's the time patient waits for the provider. So those two times make up close to 13% of the length of stay. So that was one of the observation we made. Again, the length of stay was again kind of split into different sections. One is now, what if the patient just walked in? How long is the patient going to be in the system? Again, the sample size, as I mentioned to you, 10 people walked into the clinic without any appointment, but only five of them stayed through the whole process. And so this time, what you see is basically a very small sample size. Again, nevertheless, still the average was 55 minutes, not bad. The target was within 1 hour. The maximum was 119 minutes. Again, the same thing, waiting for the provider in the examination room, and time spending with the provider in the examination room made up for most of the time there. This is for appointments. The next was basically length of stay who had appointment, and also they want the client want to know what if the patient comes in 15 minutes earlier to the appointment time. Now, is this something which impact the length of stay? So again, this is example. Now, if you have an appointment at 9 a.m. and if you show 15 minutes early, that means something after 8:45. So those were the patients. Now we kind of looked into. And an average kind of dropped below the overall average. The average was 42 minutes. I think there were one outlier there with maximum 1 hour 50 minutes. I think it was a TB patient, or they had to do some skin tests and all that. That's the reason the patient had to wait for a longer period of time there. That kind of dragged the overall average there. Same thing there. Even for these patients who come up a little early, they have to wait in the examination room for the provider, and also the time spent with the provider also was pretty high there. Then again, dissecting the data, client wanted to know the patients arriving greater than 15 minutes early. That means if you have a 9 a.m. appointment, what if a patient showed up before 8:45? Before 8:45, that means might be 8:40 or even 8:30 for that matter. Whether it made any significant difference in the length of stay, I would say no. Again, the average being 53, well below the target there. Again, the biggest waiting times, or the time consumed by the patient, was basically in the examination room waiting for the provider, and also talking to the provider in the examination room. Again, the sample size was pretty small there. Now, out of those, based on the criteria we put, there were only 5 patients who showed up more than 15 minutes early than their slotted appointment time. Again, time to see the provider. Again, different categories there. All the patients there. This is from the time they enter to see the patient there. So it takes an average of 28 minutes for all the patients. For walk-in clinics, walk-in patient, it's 40 minutes. As you can see, if you don't have an appointment, you're showing up. Again, the sample size is small, but again, it's kind of more understood that you have to wait for a longer period of time because you just walked into the clinic. Sometimes you were lucky, but sometimes if you were behind some of those scheduled patients, you had to wait and seen by the provider. Again, for the next category of patients, patients arriving less than 15 minutes early and more 15 minutes early, it didn't make that much of difference. Average was again 27 and 26 minutes. Again, it did for patients arriving greater than 15 minutes early. As I mentioned, there were only 5 patients there. Again, it's a small sample size. And other administrative activities we had to observe is basically answering the phone call. The CA, remember the CA is a person who is kind of a jack of all. She has to take care of the registration. She has to answer the calls. She has to take appointments. Make appointments. She has to take some vital statistics of the patients when they go into the examination room. So she was pretty busy running around doing several activities, and apart from routine activities, she has to do some pre-shift and the post-shift activities. This is basically clock in or removing the trash, setting up the office. Most of the office was pretty well set. She has to go through some closing activities, counting cash, processing payment, and basically, she had to go through, log into the system and some closing activities. So these were kind of taken into account, when we came up with the activities for the CA. Again, this is basically a summary of all the times which we went through for all the patients. The length of stay was 46 minutes. Now, walk-in had a little higher length of stay, but patient who had appointment who but showed up a little earlier than 15 minutes, kind of had the lowest length of stay. Again, this is again a summary of all the data in one spreadsheet, one slide, you can say. Again, some of the tasks we were supposed to do is basically compare the actual data with some of the known benchmark available for walk-in clinics. So this walk-in clinic, we said 90% of the patient took 48 minutes or less to see the provider. According to the benchmark data for urgent care, 92% of patients should take less than 30 minutes to see the provider. So they were a little on the higher side. The next was basically the length of stay, comparing the length of stay to the benchmark. This clinic had 84% of the patient taking 60 minutes or less for the length of stay. According to the benchmark for urgent care, 90% of the patients should take less than 60 minutes for the length of stay. Again, the number of patients per visit in an hour for this clinic was 2.8 patients, but average for an urgent care, they kind of take care of 3 patients in an hour. And the other thing is basically we were looking at the model in the sense how is this how are they staffing this the clinic, and this clinic had one provider and one CA, and some of the staffing models which we have seen is basically one physician, one physician assistant, 2 medical assistant. Again, it depends upon different models to cater to different you can say cities or patient or customer profiles. This walk-in clinic had 2 examination or treatment rooms. Some of those urgent care and kind of have an average 7 examination or treatment rooms. So this is basically comparing the data what we collected to the benchmark. And some of our recommendation or observation we made, as we mentioned, most of the patient went through the system smoothly and efficiently. It was a pretty smooth process, I would say. Maximum we saw only 3 patients waiting in the waiting room outside at any point of time. Again, this might be a combination of waiting for the CA, waiting for the provider, something like that. So the other observation we made, the patient arrival pattern has an influence on length of stay. We said 100% of the scheduled patients come in for their appointment on time or early with an average of 8 minutes. So that means if you keep up with your schedule, I think you would less length of stay. But again, it all determined. It also has the walk-in patient also makes an impact on your scheduled patient, because let's say you have 3 appointments during that 3 appointments, and one walk-in person shows up, and after that there's the person who has an appointment time. Basically, the 5th patient has to it's based on first in first out. Even though they have appointments there, so even though the patient has an appointment at a particular time, the walk-in person kind of might be if patient is a little late, slot will be given to this walk-in person. So walk-in patient has a kind of negative effect on people who had taken appointment too. So one of the things which kind of helped smooth the processes, they had some iPads there. Initially they had only one iPad, but when at certain period of time when people showed up, especially the walk-in patient showed up, the CA basically went inside and bought one more iPad for people to sign in. So that really helped smoothen the process or reduce the length of stay there. Again, the survey time at the end of process took less than 40 seconds. Again, it was basically 3-part questions to them. They nothing complicated there. And also we observed the phone calls went unanswered. That's, remember I mentioned about the CA who's running around doing several tasks. So she was busy when these phone calls came in, but we kind of made the observation about unanswered phone calls. Again, appointment versus walk-in, observing the flow. Appointments definitely help to smooth the flow. It's less stressful for the CAs to manage a few patients at a time instead of many people waiting in the waiting room. Again, research has shown that if people wait, long waiting times will impact the overall satisfaction of the service. People, by human nature, we don't like to wait. We want to get it done as quickly as possible, and especially when you're sick, you have a flu, or your knees are hurting or something like that. Your patience kind of reduces, right? So that's what we basically want to say, that now trying to reduce the overall waiting time will definitely help to get a better satisfaction score, and also it'll be less stressful for the CAs who are kind of jack of all, trying to manage the crowd in the waiting room. Other observation we made, I think this is again specific to this clinic. Now we saw some cardboard boxes behind the front desk, which didn't look good, looked cluttered. Again, it's something physical appearance of of the clinic. The clinic had a nice big TV there, but it was never switched on. So I don't know. I think sometimes now watching something might take your interest away from waiting there. Now it might you reduce your or improve your overall satisfaction, because your mind is occupied watching something. That was something which we said, which we mentioned in our recommendation. I think our data collection method worked fine. We basically said that initially what we did was we did a manual checking and checking the times and all that, but I think next time onwards we said basically we'll have a spreadsheet with with a tablet there, and we can kind of put those times there. That way it'll be easier. There'll be no data entry from sheets or clipboards to an Excel spreadsheet, that thereby saving us a lot of time doing